folks who have tears like a rotator cuff tear, there's lots of treatment options. It isn't like every single rotator cuff tear a person's got to run and get prolotherapy. You know, I had a really significant injury, fell on my shoulder, Labor Day weekend. You know, I'm a prolotherapist. It's easy for me to get prolotherapy. So literally I had 2 prolotherapy treatments for my rotator cuff tear, and probably within about 6 or 7 weeks I was swimming. So personally, I think prolotherapy is actually the most cost-effective treatment for a rotator cuff tear. Now granted, it's more invasive than physical therapy, but I don't know about the person watching this, but me, I don't have time every 2 or 3 times a week for like 6 or 8 weeks to be getting physical therapy. Prolotherapy of the shoulder, you know, is very cost effective, so you get a couple of visits, you know, you start exercising to pain tolerance, and normally if you come in very quickly, it's just 2 or 3 visits. If somebody waits, you know, they have a rotator cuff tear, they get cortisone shots, physical therapy, surgery, and all these things, then you come and get prolotherapy, yeah, it's probably going to be 4, 5, 6, 7, 8 visits. It's going to take a long time to regenerate enough. But for the acute rotator cuff tear, anybody who has a partial tear, you can get prolotherapy, and normally it's going to respond very quickly. So if a person can raise their hand over their head, if you can raise your hand over your head, that means that you have an incomplete rotator cuff tear. Incomplete rotator cuff tears typically respond great with prolotherapy. So that's when I would get prolotherapy. If you have a complete rotator cuff tear, it means that you had a trauma, you had a sports injuries, you can barely move your shoulder at all, and the supraspinatus tendon, it's completely torn. There's a separation. Well, then you have to get surgery, so you have to get surgery. Typically, when you get surgery, after surgery, you need physical therapy. There is a role for physical therapy, but in a lot of the customers that I see, you just got to get prolotherapy, and then you just start back to your normal exercise routine, and then that's all you need. So in that respect, I think it's probably the most cost-effective treatment for rotator cuff tear.